Community Health Partners is a not-for-profit organization founded by local community health committed to improving access to health care for the uninsured of Washington and Oregon. Community Health Partners free medical and dental clinics serve local uninsured adults in the areas of urgent and chronic care, sexually transmitted infections, and preventive and restorative dental treatments for Medicaid children, their parents, low-income adults, veterans, and seniors. Community Health Partners is committed to keeping our area families healthy through free medical and dental clinics and acting as partners in community care through healthcare advocacy.
I've always felt like we need to give something back as professionals, and the nature of healthcare here, there's always people that are kind of uninsured or underinsured, and I know that when this clinic started, the concept was, well, you know, a lot of these people are going to the emergency room. It's not appropriate care there, but they need care, so what can we set up as an alternative? And I actually was involved in getting the Family Health Center, which is the community health center, started years before that as an FQHC, but there was still a need for another clinic. So that's how this came to be. And at that time, Gordon and I talked to a lot of the other docs in towns and got enough volunteer physicians to staff it, and then Kent or Har and Sister Ann and others really helped to get a lot of volunteer nurses and others to get the thing off the ground and get some funding through the Healthcare Foundation and Peace Health and Kaiser, and that's how it started. We used to say our goal was to shut it down because everybody would have health insurance. It's basically a safety net for people. It makes a difference. I think for some people that don't have insurance, they hopefully feel like, well, if worse comes to worse and I'm not getting better, I always have one place I can go where they won't charge me. And we try and make it simple and see you and give you the medications here. We have a little pharmacy. We keep the meds simple. We don't do narcotics or anything like that, but we treat a lot of common illnesses. And then we've got some partnerships with the hospital and the radiology group and some of the specialists who will see some of our patients who need a little bit more care. And then we really started as an urgent care. We feel like I want to treat the people in the free clinic the same way I would treat people if I see them in the Kaiser Permanente clinic. And I think that's how all the doctors are, and that's how we try and work it in the nursing staff. We try and treat people with the same respect as anywhere else. But it is a free clinic, and maybe there is that stigma. If you're somebody that doesn't have health insurance and doesn't have much money, doesn't have access to care, this is a place you can come to. We'll treat you with respect. We'll do our best to take care of you. We'll try and figure out a solution for your health care problem. And if you need chronic care, we'll try and help bridge you until we can find you a provider to take care of you long term. And if there's a problem that needs specialty care, we'll try and find a way to help you with that. And we take advantage of the specialists in the community who partner with us. Sometimes we have to send people to Seattle and Portland, but we'll try and work with you. And we're here to. When I was a kid, my dad died when I was 8, and I remember we didn't have much money for the first few years, and and I had a pediatrician, Dr. James Ball, and he used to see us in the back door and took care of us for free. That was in the old days, 50 years ago. But this is a way to kind of get back in the modern healthcare world. So we can come here and volunteer and try and let people kind of get a little help who are having a rough time.
Community Health Partners operates within donated space inside Kaiser Permanente at 1230 7th Avenue in Longview, Washington. Community Health Partners are able to help refer to primary and specialty care providers and other community resources. Our advocates can also help you get enrolled in federally funded medical assistance programs. Community Health Partners free medical and dental clinics are made possible through many generous individuals and organizations in the area, such as and so many skilled volunteer physicians, nurses, medical assistants, registration clerks, interpreters, and more. For more information on how to donate, please visit chpwa.org. Call our information line. Community Health Partners, partners in community care.